All right, hello. My name is Kira Taylor. My pronouns are she, they. I am one of the Project TEACH interns here at Philadelphia Fight.
And my name is Maggie Rafferty. My pronouns are she, her, hers. I am one of the interns here at Project TEACH with Philadelphia Fight as well, and I'm with the Westchester University Social Work Department.
And I'm with Widener University's dual degree Social Work and Human Sexuality Department. So TEACH is a subset of Philadelphia Fight, and it is essentially an advocacy and education program that's through Philadelphia Fight. TEACH stands for Treatment Education Advocates Combating HIV. And today Maggie and I are going to be talking about COVID-19, what it is, and how to protect yourself. So this is our outline of the things we're going to be talking about today. So first and foremost, COVID-19 101, explaining what it is, how it infects the body, different variants that have been showing up in recent months, just sort of rebuffing your knowledge about COVID-19. Next, we're going to go into COVID-19 vaccines. So that includes the different kinds available, mRNA versus the protein-based vaccine that is new, different efficacy rates, so how effective each different vaccine is, some new information specifically regarding the newer protein-based vaccine, and then launching into some myths and facts about vaccines, what they do, and more importantly, what they do not do.
And then from there, we'll move right into going over different types of masks and their levels of efficacy, and just what different masks are best for different situations. And then from there, we will go into COVID-19 testing. So we'll go into the different kinds of tests, different situations for different testing, and all that stuff. And then we'll finish up with some emerging research, which will give you some more information about new and upcoming interventions that are on the market for COVID-19 protection. COVID is a highly contagious and highly transmissible respiratory infection, and it's spread through air transmission. So for example, if someone who's infected with COVID were to cough, some of the droplets will get in the air and you could breathe it in and get infected that way. And with COVID-19, it can lead to lasting damage to the body. So some post-infection symptoms and damage is being studied, and it progresses over time. Long COVID can consist of fatigue, chronic pain, heart palpitations, depression, sleep disturbances, and more. So there's a pretty hefty list of different things that can happen after COVID infection. Another thing that can occur is some damage to the immune system after infection. So some development of autoimmune diseases has been seen, some longer healing periods for other infections, and more susceptibility to severe illness from other infections after infection from COVID-19. Basically, the symptoms include fever, cough, tiredness, and loss of taste or smell. Symptoms can vary from person to person, but not being symptomatic does not necessarily mean that you are not contagious. So whether or not you are feeling the symptoms of COVID, but you have that positive test, you are still contagious and should quarantine and stay away from people as much as possible. And just determine what kind of tests you would need. PCR tests are a bit more accurate than the rapid antigen test, but we will get into that a little bit more later on in this presentation.
So working our way from COVID 101 to the different COVID-19 variants that we are seeing kind of pop up from the Omicron variant. COVID-19 variants are ever changing. New variants will arise as COVID continues to exist. This graph is a little bit confusing, but think of each little stripe and every different little color as a different variant, essentially. And so you'll notice that some colors or some stripes are bigger than others. Currently, the top two that are the most common right now are that kind of yellowy, tan-ish color at the top, which is the EG5 variant, and then the one that's in the middle there, that kind of army green color, is the HV1. So those are the two current dominant variants as we kind of roll into flu season. So these Omicron variants, essentially they're variants of the Omicron variant, are known to be highly transmissible. However, that being said, new booster vaccines are being rolled out and are incredibly effective against these newer variants. So working our way into COVID-19 season also kind of means that we are in flu season as well. So flu season peaks from around December to February in the United States. COVID cases have been shown to rise in a similar fashion during the same kinds of colder months. So severe cases are more common during flu season due to the possibility of co-infection of COVID-19 and the flu, which is not very fun. Nevertheless, COVID-19 transmission has been mostly steady year-round, as we are, though, seeing a spike towards these colder months as we enter into December. Masking and vaccines are incredibly effective against severe COVID and flu cases, as well as transmission.
So COVID-19 vaccines and boosters. The CDC recommends the updated vaccines from 2023 and 2024. So this year they've rolled out some newly updated vaccines to cover some of those new variants that Kira was just discussing. So they'll have you covered for those variants with the new vaccine. They are recommended for everyone 5 years old and above. So if you're a child or if you're an older adult, they're recommended for everyone. If you are immunocompromised, it is recommended that you do get all of your booster shots to make sure that your body is being as protected as possible against these infections or against this virus as it keeps evolving. And children 6 months to 4 years old require multiple doses of the vaccine, including the updated vaccine. So just making sure that they're up to date on those as well is very important. How often should you get a booster? According to the CDC, people should wait at least 2 months from their most recent dose and about 3 months after infection in order to maximize their protection. They also stated that a booster every 6 months is still within range of vaccine efficacy. So about every 6 months you should be updating, or not updating, but getting another booster to keep that immunity updated.
So the types of vaccines that are available here. So first, this is the most common or possibly the most heard or talked about kind of vaccine, the mRNA vaccine. This type of vaccine gives your cells instructions for how to make the spike protein that's found kind of on the surface of the COVID-19 virus. So essentially, after vaccination, your muscle cells begin making this spike protein and that's pieces and then displaying them kind of on cell surfaces. This causes your body to then create antibodies, which are then incredibly effective at kind of combating any sort of COVID-19 infection. So again, if you later become infected with the COVID-19 virus, these antibodies will fight the virus. And so currently, in the United States, the Pfizer and Moderna vaccines are the mRNA vaccines that are available to be administered in local pharmacies, hospitals, etc. And so the second kind of vaccine, this is a newer one that we are seeing, is the protein-based vaccine. So this one works essentially the same way. So a subunit protein vaccine works by supplying the already made spike protein that your immune system then produces antibodies to protect against COVID-19. So the same kind of thing with the mRNA, the mRNA gives your body the instructions on how to make the spike protein, which then your body makes that spike protein. The subunit protein vaccine then works by supplying an already made spike protein. So they work the same way. They're both equally very protective against the virus. So again, if your body is infected with COVID, the antibodies can fight against the COVID infection, preventing serious illness or like serious hospitalization. And then currently, the Novavax vaccine is the only FDA-approved protein-based vaccine available in the United States.
So Pfizer, which was actually the first COVID vaccine that was rolled out in the United States, it has a 95% efficacy rate in protecting against the virus and transmission, or from virus transmission and serious hospitalization, which is super high. So yeah, it's a very good percentage. Moderna, which is our other mRNA vaccine, has a 94% efficacy rate, which is also super high, just 1% lower than that Pfizer, so it's still a really great option. And then moving into Novavax. So Novavax is, like Kira just went over, the new available protein-based vaccine for COVID in the US. It has a 90% efficacy rate, so it's a little smidgen bit smaller than the mRNA vaccines. But the interesting thing about protein-based vaccines is that because of the way that they're formulated, it does not induce as much of an inflammatory immune response. So folks living with chronic illnesses, like myself, I have a connective tissue disorder. I had a pretty severe flare-up with some pre-existing symptoms that I had from an mRNA vaccine that I had previously gotten for COVID, so I'm really excited to try this Novavax protein-based one to see if that gives less symptoms.
And so then kind of comes the question, with all of the different kinds that are available, are you able to mix vaccines? So essentially, there are currently no risks for mixing COVID-19 vaccines with other brands. For example, if you received a Moderna vaccine in like the first round, kind of 2021, when vaccines were being rolled out, receiving a Pfizer vaccine is safe and will not cause your body any harm or lessen any kind of protection. Some medical experts recommend mixing vaccines with the hope of broader protection against varying strains of COVID-19. I know for myself, in the first round, I got Pfizer vaccines, and then now I have since gotten, I think, the Moderna vaccines in the last couple rounds. And then you might have noticed we did not include the Johnson & Johnson vaccine, so just a word about that. If you received the J&J vaccine and never received a booster, considering that the Johnson & Johnson vaccine was a monovalent, meaning a one-dose vaccine, it is highly recommended to receive a booster from either Pfizer, Moderna, or Novavax, which are all bivalent, meaning 2 doses, and I think a couple of these, like since the boosters have been rolled out, they can even be kind of 1 dose with all of the other progressions. But receiving a booster from either Pfizer, Moderna, or Novavax will offer more protection against evolved strains of COVID-19. So it is really important to just be aware of that, essentially.
So after talking about vaccines, we felt it was pretty important to touch on some myths and facts regarding COVID and COVID vaccines, as there's a lot of misinformation still going around as the pandemic is still progressing and moving forward. So the first one that we're going to touch on is that COVID-19 vaccines give people COVID. But the fact of the matter is that COVID-19 vaccines do not cause people to get sick with COVID. The vaccines actually do not contain any of the live virus, so it's pretty much impossible, not pretty much, it is impossible for the vaccine to infect you with COVID-19. Some people may experience some muscle soreness or fever or fatigue after they have the vaccine, but that's actually kind of proof that it is indeed working. You're having that inflammatory immune reaction, and it typically goes away in a few days.
So the second myth here is that COVID-19 vaccines affect fertility. This is indeed a myth. This is not true. Currently, there is no evidence, literature, or research that proves COVID-19 vaccines cause fertility problems. Getting vaccines actually does improve protection amongst new mothers, people that are pregnant, and the children inside them. So COVID-19 vaccinations keep you and your child safe. The CDC recommends the vaccine for people who are currently pregnant, trying to become pregnant, or are chest feeding as well.
And then next, we are going to be talking about whether or not COVID vaccines have microchips, and they do not have microchips in them. This myth actually started after comments made by Bill Gates and the Gates Foundation about a digital certificate of vaccine records. I actually did not know where this myth started from, so it was actually pretty interesting to go back and understand where it started. But the technology that Bill Gates was referencing is not a microchip. Microchips have never been implemented in COVID-19 vaccines, nor will they be.
So another myth we wanted to kind of cover, last one we're going to cover in this presentation here, is that COVID-19 vaccines change DNA. Once again, this is not true. COVID-19 vaccines work by delivering instructions to build spike proteins or directly deliver spike proteins, like the new protein-based vaccine, that then teach your immune system how to build protection or antibodies against COVID-19. COVID-19 essentially works with your body's cells and doesn't have anything to do with DNA. Vaccines kind of can't change your DNA. It's not something that happens. Additionally, vaccines do not contain preservatives. They do not contain antibiotics. Live diseases, as Maggie went over. I believe metals is what that says, glass, or aborted fetal tissue or cells are all things that are not found in vaccines.
Awesome. So moving forward, we're going to start talking about different types of masks. Masking was our first defense against COVID once the pandemic started. And as the pandemic has been evolving and COVID has been evolving, we have some more information on the different levels of efficacy, so we thought it was important to discuss that. First and foremost, we have the respirator type masks, and those are your N95 and KN95s. Those are, yes, that one. They are the most effective type of mask. They can filter out about 95% of particles down to 0.3 microns. And an N95 or KN95 mask can limit your chances of contracting COVID of up to 83%. And then moving into surgical masks, they are also effective when worn correctly. They can help lower the transmission of COVID-19 by about 66%. And then cloth masks are the least effective. When they're worn correctly, cloth masks can lower the risk of COVID transmission by about 56%, even though... Yeah, that's still half. Even though those numbers for the surgical masks and cloth masks seem smaller, that's still over half. You're still protected by over 50% against COVID by wearing those masks.
Reduces your chances of receiving it by half.
Yeah, by over half.
So when Maggie says when used correctly, essentially this is a fun infographic on how to wear a medical mask or a surgical mask, as this kind of infographic displays correctly. So we have a few different ways that you can do this. I do want to preface by saying that not following these step by step does not mean that you are going to get COVID, does not mean that you're wearing your mask wrong. This is just best possible practice for the most protection possible, essentially. So washing your hands before you put your mask on, making sure that it's not broken or if there are tears or rips or anything, making sure that you are wearing it color side out, so blue is facing you, essentially, is a good thing to remember. So making sure that the metal part above your nose is pressed tightly to your face, covering your entire 2/3 of your face, nose, mouth, and your chin, all the way around your face, making sure that it's close to your face as well. When you're taking it off, keeping the outside of the mask away from yourself, throwing it away, trying your best to use masks just once. That's not always accessible. Again, any mask is better than no mask. Trying not to touch your mask while you're wearing it, washing your hands after you discard it, are just some best practice type of things. And then we have some don'ts, essentially. So that was our do's, these are our don'ts. Again, best practices. These are just some key pointers, I think, that are important to note as well. Again, not wearing a mask that is torn or ripped, dirty, with dirt, God forbid it had been on the ground. Not wearing it like this, where it's with your nose out or in your face like this. Making sure that it's not super loose. Again, any mask is better than no mask. Sometimes masks aren't always going to fit. There are things you can do, like switching this around your ear so that it is kind of crisscross, so that it's a little closer to your face. Trying not to touch the front of your mask, unlike how I'm doing now. This is something I am incredibly guilty of doing. Things happen.
Me too.
Yeah, it's something that just kind of, you're gonna do what you're gonna do. Making sure that you're being safe and wearing it correctly, though, with covering your nose, under your chin, close to your face, that's gonna do you the best. And then about not reusing masks. Masks aren't always accessible to everybody, so if you need to, I say do. Just in case you need to be as safe as you can be. If you have availability of fresh masks, if you're going to different medical facilities and things, they kind of offer masks, but yeah, these are some do's and don'ts on wearing masks here.
So after talking about masks, we are going to move into COVID-19 testing. So the first test we are going to talk about is a PCR test. PCRs are the gold standard of COVID testing. They're a type of nucleic acid amplification test, so NAAT, which are more likely to detect the virus than an antigen test, which is a rapid test that we'll touch on shortly. They can take up to 3 days to get results, so you need to go to a testing facility or something like that, like a doctor's office, and they administer that test for you and send it off to a lab to get the results. If you're only going to take one test, a PCR is your best option because that test will provide a more reliable and more trustworthy negative result than that antigen rapid test would. And then where to get a PCR test. So medical facilities such as your primary care provider, urgent cares, different labs, and different testing centers are really great options. Pharmacies and drugstores also have PCR tests available as well if you go up to the counter and ask one of the pharmacists there. And then something in Philadelphia, there are different community events, community testing events. So there's no appointment required and no out-of-pocket cost, which makes it pretty accessible. The only thing that makes it not as accessible is the alternating locations weekly, but you can check out where they are each week at www.phila.gov.
And so the second kind of test that's available, this one possibly a little bit more available, is the antigen test. This is also known as a rapid test, so you usually get your results in about 15 to 30 minutes. You are able to do this at home, making it more accessible, as I had mentioned. It is important to note, essentially, that if you use an antigen test, a positive result is reliable, but a negative result isn't always accurate. I'll get into kind of the way that antigen tests work in just a second, but if your antigen test is negative, take another antigen test after 48 hours, or take a PCR test as soon as you can if you're feeling some symptoms, essentially. Every home in the United States is eligible for 4 free at-home antigen tests through the government at www.covid.gov/tests. They're available for purchase at pharmacies. You can get them delivered to your door with apps like DoorDash, GoPuff, Grubhub, Instacart. And there are also many community-based organizations that may have access to these resources as well. For example, if you have a case manager, asking them where some tests might be, what resources they have for free testing might really be very helpful to you. As for the Philadelphia area, the Philadelphia Health Department offers 2 free at-home COVID test kits available Monday through Friday at any of their resource hubs found at the same website here, www.phila.gov. And for these tests, no insurance or ID or purchase is required. And so how do you know which test is the right test to get, right? So between the two, antigen and PCR. So antigen, less accurate, PCR is a little bit more accurate. However, antigen is more accessible, available for free in many cases. PCR, a little bit less accessible, has to be done in a doctor's office, at a pharmacy. There are community programs, but then again, that is something that has to be scheduled. With an antigen test, results usually arrive in about 15 to 30 minutes. You can do that at home. You can sit there right there with a timer and watch it happen. With PCR tests, you get your results in about 2 to 3 days. Again, this is more accurate, so you might have to wait just a bit, making sure that you are quarantining if you are feeling symptoms. With antigen tests, they're the most effective if you are showing symptoms. They're less effective in detecting an asymptomatic infection. However, if you are still feeling some symptoms, a positive result from an antigen test is pretty reliable, if nothing else. With PCR, it can detect a more asymptomatic or a moderate infection that an antigen test might not be able to. Again, more accurately than an antigen test might be able to. With antigen tests, you might need to take a second test after 48 hours of your first test if you're still showing some symptoms, and PCR is kind of a one and done situation.
Awesome. So after testing, we're going to talk about some of the emerging research. As a disclaimer, these options are not a replacement for masking and vaccination. They're to be used in addition to masking and vaccination. They are not FDA approved yet for the treatment of COVID-19. They have been designated GRAS, or GRAS distinction, by the FDA, which stands for Generally Recognized as Safe. It sounds a little confusing and weird, but basically it just means that they can't claim to have any medicinal benefits yet. Going off of that, doing your own research is important. We are not giving medical advice.
No, we are not medical professionals.
Yes, we're not medical professionals.
No.
We're just sharing information. So going off of that, we're going to move right into the HEPA air filters. That stands for High Efficiency Particulate Air Filter. Some of these filters are actually FDA approved, but not all of them are. So if you do want one that's specifically FDA approved, you can look into which brands are specifically FDA approved. And then they remove 99.99% of dust, pollen, mold, bacteria, all that stuff within a size of 0.3 microns, which is awesome. And these are not to be used alone. Like, these are not enough to be used alone to protect against COVID. So again, masking, vaccination, social distancing when necessary, all that stuff is very important. And then the next one we're going to talk about are the nitric oxide nasal sprays, or NONS. They work through two modes of action. So they either prevent the fusion of the spike protein, which is the COVID cell, to its ACE2 receptor, which sounds confusing and fancy, but basically it keeps the COVID cell from attaching, connecting to anything in your body. And then it also reduces the viral RNA generation in the beginning stages of the viral replication. So when that virus is starting to be reproduced, it kind of shuts that down. And it also promotes vasodilation, and that's sort of opening up your lung passageways so that oxygen can get taken in by them better.
And then another one here with emerging research are CPC mouthwashes. So early studies show that mouthwashes containing cetylpyridinium chloride, or CPC, can reduce COVID-19 virus in saliva. This could potentially be used to help prevent the spread of COVID-19. Again, just like Maggie said, this is not FDA approved. This is like a possible future treatment option for further protection, in addition to masking and vaccination as well. And then our last little emerging research here are far UVC lamps. So far UVC is a region of like UV light, or like black lights, light spectrum that inactivates viral and microbial pathogens. So it kind of makes them ineffective. It is effective against COVID-19. It is safe at 222 nanometers for human cells, skin, and eyes. However, the long-term effects are still very unknown. They're better for public spaces, businesses, large venues. They're not exactly accessible by a person-to-person basis, but they are good for potential transmission reduction as well.
Bottom lines, getting vaccinated against COVID-19 and wearing your masks are the most effective ways to stop the spread of the virus and sort of the most important steps to stopping the spread.
Right. And then there are also many myths about COVID-19 vaccines, but it is important to remember research has proven that the vaccine is safe and very effective.
Some other precautions can potentially be used as extra protection. However, like we said, vaccines and masks are the only FDA-approved methods to fight COVID-19, and they are the most effective. And as a reminder with that, always do your own research, always check in on these ever-changing new modes of protection, because they are ever-changing and new research is coming out more frequently. So it's important to stay on top of all of that information.
Right, and then making sure that you're checking into different verified sources, FDA, the CDC, WHO, the World Health Organization, making sure that that is a verifiable source of what treatment that you're checking from. That being said, we can all do our part to protect ourselves and others from COVID-19. So again, wearing your masks, getting your vaccines, getting your boosters, making sure that you are being safe, and just overall making smart decisions, essentially.
That's it from us.
Thank you so much.
Yeah, thank you.